Hi, my name is Joyce Artia, and I'm going to tell you about the source of fluids and electrolytes and integrate views of potassium homeostasis. Definitions is a condition in which levels of serum potency appear lower than normal values. Potassium, essential carry-on, facilitation of nerve conductions and contractions of the smooth and skeletal muscle, including the heart. It also facilitates the functioning of the cell membrane and various enzyme systems. The homeostatic balance of potassium must be maintained and correct level for remains of life. The normal concentration of potassium in serum is 3.5 to 5 mql. So it is considered hypokalemia when we have potassium values below 3.5 mql. Hypokalemia can occur due to main cause depletion of the total potassium cones of the organism or excessive intake of potassium into cells, especially muscle cells.
Hey guys, Mike Linares here, and welcome to SimpleNursing.com. Today we're talking about electrolytes, or electric light. Electrolytes are found in the fluids, and they light up your body with this electric energy. So I call them the underwater electric disco dance party of the body. Because please remember this one token of information. Where fluids flow, electrolytes go! Electrolytes are ions that are found in your body fluids. They help to conduct electricity and energy, which helps control body fluids and maintain homeostasis, this balance of the body. Basically, they help the body send messages from cell to cell, nerve to nerve, and organ to organ, kind of like little paper boys relaying vital messages all over the body. So without them, your body, your brain, and basically your life would cease to function. So today we'll be going over three things. First of all, what disrupts electrolyte function? Secondly, which foods have the most electrolytes? Something that Select All That Apply questions love to ask you on your nursing tests. And also third, electrolyte values and priorities. Laboratory values that you will be tested on, like, for sure. Also priority signs and symptoms, nursing assessments, as well as those crucial nursing interventions. Basically everything that you should have highlighted in your book. So I'm taking the guesswork out of it and highlighting the book for you. We're only covering the most important things that love to show up on nursing exams and ultimately the NCLEX. Now, as mentioned before, electrolytes help you pass electricity to the brain and to the nerves, but mainly used in our skeletal muscles, helping them to squeeze and contract, from the muscles in the heart to the muscles in our deep tendons, even to the muscles in your intestinal tract, also known as your GI tract. Now, if you ever played sports or even talked to a personal trainer at the gym, you probably heard something about electrolytes. Even a coach has probably told you, you gotta drink your Gatorade to increase electrolytes. And even teen moms will give out oranges at baseball games.
Applications in medicine. The importance of potassium homeostasis is underscored by the well-recognized finding that patients with hypokalemia or hyperkalemia have an increasing rate of death from any cause. In addition, the range of potassium homeostasis have been associated with pathophysiologic processes such as progression of cardiac and kidney disease and intestinal fibrosis. Pros and cons. Pros. These pathophysiological processes are reversible if they are detected early by a specialist. Cons. These pathologies can produce complications that severely affect the health of the patients.
The electrolyte balance in the body's fluids is absolutely crucial to many body processes, and any imbalances can cause serious disorders and can even be life-threatening. As described in an earlier program, the fluids in the body are filled with dissolved salts and minerals that take on plus or minus electrical charges and are called ions or electrolytes. The common electrolytes sodium, potassium, and calcium take on positive charges in a fluid and are called cations. And chloride, bicarbonate, and phosphate take on negative charges and are called anions. The concentration and charges of these electrolytes have a lot to do with how fluids move through the body and also how they pass through membranes into and out of cells and blood vessels. Osmosis, diffusion, and active transport are all processes of fluid transfer through membranes that are dependent on the concentrations of electrolytes. Imbalances in electrolytes can disrupt this flow of fluids and cause many pathological conditions. This program will discuss imbalances in some of the main electrolytes in the body.
Hi, so I chose to read an article about the benefits of potassium. So to start off, potassium is important for a cell's action potential, and it's a nourishment for neurons, glia, and cells. Extracellular potassium body and organisms are believed to have evolved within an environment with high potassium to low sodium ratio. But in today's modern diet, there's more sodium than potassium, which accounts for obesity, high blood pressure, which is hypertension, and heart disease. By having more potassium in one's diet, it would help lower hypertension. It has benefits for the kidneys, and it's overall important for the body's homeostasis. So it's really, really important that we get plenty of potassium in the diet to nourish the cells and be more healthy.
Issue applied in Ecuador. It is observed that the main electrolyte imbalance that present more frequently in the population of Ecuador. Through an investigation, it was demonstrated that the factors that entail to an electrolyte imbalance are the underlying pathologies that correspond to 27%, such as diabetes mellitus type 2 and pneumonia acquired in the community, followed by the corresponding iatrogenic to 23%. It was determined that the main cause responsible for the complications hydroelectric are the underlying pathologies corresponding to the 27% being easy to the identified and using diagnostic techniques to avoid future complications.
Introduction to fluid and electrolytes. Fluid and electrolyte balances are necessary for homeostasis. This presentation and the following videos will help you become better aware of how to assist your patient in regaining and maintaining homeostasis. In this series, we will also discuss normal and abnormal fluid and electrolyte balances, the factors that contribute to these imbalances, the types of imbalances, and the nursing interventions you can use to correct the imbalances. Part 1, we will first focus on fluid balance, including hypovolemia and hypervolemia. And then Part 2 will cover electrolyte imbalances and look at each electrolyte individually. Each of these will be broken down into bite-sized videos for better understanding and added to a playlist so that it's easy to find the next video. So let's get started. First, we'll speak of the importance of fluid balance in our bodies. Fluid is a major component of our body. It serves a vital role in our health and in normal cellular function by serving as the medium for metabolic reactions within the cell. It is also the transporter of nutrients and waste products, a lubricant, an insulator, and a shock absorber. Fluid serves as a means of regulating or maintaining body temperature. Fluids may enter the body through the food we eat and the beverages we drink. Fluids leave the body mainly by the elimination process of urine, feces, and through the skin. The amount of water in our bodies declines with age. For instance, a newborn body consists of about 75% fluid, while a healthy adult's body is composed of 60% fluid. 40% of the body's water is in the intracellular space, which you will see abbreviated as ICF, which stands for intracellular fluid. The extracellular fluid, which you will see abbreviated as ECF, accounts for 20% of the fluid, 14% in the interstitial space, and 5% in the intravascular space. Transcellular fluid, like cerebral spinal fluid and fluid contained in the other body spaces, such as joint space, pleural, peritoneal, and pericardial spaces, makes up the remaining extracellular fluid. Extracellular and intracellular fluids contain solutes, which are substances dissolved in the body fluids, such as dissolved nutrients, waste products, and charged particles called ions or electrolytes. Fluid and electrolytes play a vital role in homeostasis, which is the ability of the body or cell to seek and maintain a condition of equilibrium or stability within its internal environment when dealing with external changes. Homeostasis must exist for the cells to function properly. To maintain homeostasis, fluids move between compartments through selectively permeable membranes by a variety of methods, such as diffusion, active transport, filtration, and osmosis.
Conclusions. In humans, there are marked transients related increase in renal potassium excretions that depends on rapid change in active potassium secretion and reabsorptions in the distal nephron. These reactive responses are superimposed on a predictive enhancement of the transport mechanism that occurs at the times of date when meal intake conventionally occurs. Thence,